Welcome to the King's Podcast Season 2. Today we're joined with Maddy. Would you be able to introduce yourself just for the people listening at home?
Yeah, absolutely. So I'm Maddy. I'm one of the midwives at King's. I currently work as a midwifery advisor, which is a new team that we've set up over the past 3 or 4 months. So I work with a couple of other midwives, basically being everyone's midwife. So we're no one specific. We're open for everybody. It's a complementary thing. We're always around for drop-in support. We teach the antenatal classes. No silly questions for us. We have a WhatsApp line, so anytime, anything you want to know in your pregnancy, you can always reach out to us. As well as my background is, for the last year, I've been working on the labour ward here at King's. So a bit of both, and I still hope to do a few shifts on the labour ward because it's where my heart is. But it's great experience, you know, for real life scenarios, that all the questions I often get asked.
It's a good thing you said no silly questions, because we might have a lot of silly questions today. Danielle and I have never been pregnant. We want to put ourselves in the position of pregnant women and talk about pregnancy fears today. So let's start with, right as you get pregnant, what kind of questions do women come to you with, like just as they got pregnant or found out?
I think the biggest thing is, like, what do I do now? Because I mean, it's scary taking a pregnancy test. One, if you know, is it going to be positive? Is it negative? And also there's so many scenarios why people do them. You know, have they been trying for a long time? Is it a surprise, unplanned, or you've just had a baby and then recently found out you're pregnant again, which happens a lot. And we can get into that later. But yeah, often it's just like that shock, you know, even if you've been trying and trying, it's still oh my God, like, it's happening. So often it's like, okay, what now? So especially here in Dubai, because it's consultant-led care, the first thing really is like to choose a doctor. We have the luxury of doing that here in Dubai. So always I just send them straight to like the website and just say, have a look through. You know, we have so many different doctors that are so good in all their own different ways. So that honestly, for a lot of people, is like a make or break kind of thing. You know, either, you know, it's because of the language that they speak, so they feel more comfortable speaking in their mother tongue, or it's because they specialize in like natural birth or C-section or high-risk pregnancy. And often, even if you're pregnant for the first time, you'd know if you had something that would mean you'd need something, you know, medical history or something like that. So that's kind of the place to start. And then obviously the midwives are around. So often if they're coming in for their first appointment, we'll just say, come and chat with us, because always there is so many questions. What can I eat? What can I not eat? What can I do? Am I allowed to exercise? Like all of these kind of like just general questions, but they are obviously important ones, because we don't want to harm our 6-week-old baby or whatever time you find out. So yeah, they're kind of the general ones really for the start.
So I guess one of the big questions that you get is, when can I tell people?
Yeah, definitely. And I think the thing is, there's no right or wrong. So if you, especially people always want to tell like their mums or, you know, the person that they know who's been pregnant, because they want to get that reassurance and ask all the questions too. And I always have, you know, I'm always the first to know, because usually they text me and they're like, what do I do? You know, and it can be from the moment you take the pregnancy test if you need that support. Or for other people, they want to wait until the kind of big screening tests and things like that. So the first kind of bigger test that you'll have is around the 12-week point, where they do the first scan and they test for lots of different conditions. So things like Down syndrome, Edwards syndrome, PATOs, things like that. So often they're kind of, you know, big conditions that it's worth thinking about beforehand. Some people will choose not to do the screening, some people will. And then the other test is around the 20 weeks, where they have the anomaly scan. So again, that's looking at all the structures for the baby and things like that. So some people, especially if they've maybe had a miscarriage before or a baby with one of the conditions, they might tend to wait a bit longer. However, there's kind of a more recent food for thought that actually people don't want to tell, you know, their friends and family in case they were to have a miscarriage or something went wrong. But actually, I think about it like, if you did have these things happen to you, you want the support from those people. So actually, you know, if you do have a few trusted people that would support you through anything, positive or negative, then my thought is maybe you should tell those people, because they can support you then throughout everything.
Yeah, that's so true. I feel like from the minute you find out, there's so many things that you could be thinking of, so many concerns running through your mind.
I bet a lot of mums, like, from that first appointment, leave it with like all weight lifted off of their shoulders, like get all of these questions out, speak to obviously professionals. I bet that feeling is like,
yeah, I hope so. That's the aim anyway. But also, like, now we started our new Instagram page. So the idea for that, because you can Google everything, and I'm always like, please don't Google things, because Dr. Google is never a good idea. And especially with pregnancy, one thing will tell you can do it, one will tell you can't. And, you know, it's just never a good idea. So the idea is with our team and obviously like good sources of support and like the Instagram is, it's all the contents come from us. So we vetted it all. We have made sure it's evidence-based, and also the evidence-based changes all the time. So I've been a qualified midwife now for almost 4 years. And in that time, even from what I was taught in university to now, some of that advice has completely changed. So it's for us as well to stay up to date. So always it's one of those kind of, you know, what is that latest evidence? Why is that a thing? And also converting it to Dubai as well, because for me, obviously, I'm from the UK and I trained in the UK as a midwife, and the practice there is similar because we're in King's London and we try and match that as much as possible, but there's differences. So even like for a newborn baby, the temperature is very different here to in the UK. So what's the different advice for hot weather and staying hydrated and that kind of thing? So yeah, for me, always I try and stay as up to date as possible because, like you say, I'm their Dr. Google. So I need to be making sure that information I'm giving is, you know, solid and evidence-based.
It's quite nice that there's one team as well, because Google can be quite overwhelming. I think pregnancy in itself can be quite overwhelming. So something else that people must have a lot of questions about, especially in the first trimester, is what foods I can and can't eat. And there's so many foods that people have questions about. So what would you say to them?
Yeah, I could go on all day about what foods and drinks and things like that. But always I tend to stick with, again, because I'm British trained midwife, I often stick to like the NHS guidelines. So actually on the NHS website, the UK NHS is basically an A to Z of all the foods and whether they're safe and whether they're not, and how cooked they need to be and what precautions you need to take. So that's often a really good way to start. And then if there's any specific questions, then I can try and help around that. But like I say, it's difficult because things do change so quickly all the time. So sometimes I'm even researching things because they could have changed since I last looked or whatever. Whereas something like that is always being updated all the time. There's teams specifically to do that. So usually I kind of will say, you know, take a look at that and then let me know if there's more questions. Caffeine's another one as well, because a lot of people have a lot of coffee. So actually, that wasn't a point that I knew. But actually, you know, especially if you're really tired in early pregnancy, which often is the case. But in general, they just say like 200 milligrams. So usually like one average size cup a day. And then, or have decaf as well is important. And same actually with breastfeeding on the other side. People kind of forget about it by then. But actually caffeine's in a lot of things you don't think about. You know, some like fizzy drinks, like, you know, I don't know if I'm allowed to mention names. Fizzy drinks and like even Panadol. Some Panadols have caffeine in. So it's just really being aware, and you can drive yourself crazy with some of these things. But I was just thinking, if you're ever unsure, that's what our number's for. I have countless times ladies just sending me pictures of the back of a packet and saying, is this okay or not? But that's fine. That's what we're here for. So.
Okay, so the only time Dr. Google is allowed is when you're on the NHS website. But what foods can I and can't I eat? Okay.
Oh, NHS in general is okay. Yeah.
To know. So the first trimester, people are generally confused. So many questions. What's the second trimester like?
Honestly, it's often people feel a bit better by then. So maybe like morning sickness and things have kind of subsided. And this is why they talk about like the pregnancy glow and things like that. But also I think it's really important because especially in the day and age that we're living in, everything's social media related. It's normal to not feel the pregnancy glow and feel super amazing. And, you know, you've got a bump and all of these things. Like some people have a tough time in pregnancy and they are really tired and don't feel like, you know, doing a lot of the things they normally would do. So I think normalizing that is really important as well. But often women say that that's kind of their favourite time of being pregnant because they're not super pregnant. So they haven't got like maybe the aches and pains they might have later on. and then the sickness is maybe gone as well. So often it's kind of, maybe a nicer time as part of the pregnancy. And at that point, especially around like the 28-week mark, is when really we talk about like a pattern of baby's movements and things like that. So, you know, that also makes it very real for a lot of people. They've maybe felt a few flutters and things and think, is it a kick? Is it not? But really from then, and again, that's a big advice that we always give to all women, is baby's movements are their only way of actually telling you if they're okay or not. So listen to them, get to know their pattern. And again, that's something that the evidence has changed over the years. So sometimes we hear people saying like, you know, actually they might slow down their movements near the end of pregnancy because they've run out of room, but it's all myths. So they should not change their pattern at all. And it's not even just like a reduced movements. It could just be that, okay, every morning I wake up and they're kicking away, and then one morning they are kicking, but they're kicking a bit less than normal, or they're not kicking at all. All of those times after 28 weeks, when you learn their pattern, we always want you to come in and get checked, because like I say, that's their way of communicating with us. And it is, you know, often you come in, we put the CTG monitor on, and then they start kicking like crazy, which is brilliant. But I always say, like, we'd rather you come in 10 times and every time they kick like crazy than that one time, you know? So that's a really important thing that we do always kind of spread the word about, because there is a lot of kind of misinformation around that. Another one we always hear as well is like, sit down, spend an hour, like have a sugary drink, have something to eat. And actually that's not the current evidence, because that's just delaying you coming for a checkup, you know? And if your baby is showing signs that they're not so happy in there and we need to do something, then you put that off by an hour because you sat and you eat. And then, you know, after you've then had half an hour to get to the hospital or whatever it is. So yeah, that's kind of a big message that I think is important in that second trimester to really know about. And then obviously that's tipping over into the third trimester as well.
So as a woman, your body is changing. And I think probably in the second trimester is when you first experience those big changes, would you say?
Yeah, I think so. And I mean, a lot of it hormonally is really like first trimester, because your body's realizing it's pregnant and it needs to do a lot of things. And the tiredness is really a big thing, because you can't see anything necessarily, you almost forget how much your body is doing. Like, especially in the first 12 weeks, all those major components, you know, the spinal cord and the neural pathways and all of these really important things are being made. And, you know, then obviously the second trimester is more like the little details. So, you know, the fingernails and the eyelashes and things like that. And, you know, always, no matter what you're doing, even if you're sleeping, your body's still making this little human. So I think it's easy to forget how much it is doing. And, you know, always I get asked like, oh, I'm so tired, or I'm always really thirsty, I'm always hungry. It's like, well, yeah, you're doing a lot of work. Like, you need to fuel your body. And often, especially in the first trimester with sickness and things like that, is just eating little and often, because you still need to fuel your body. And same with the second trimester, well, all the way through really. But stay well hydrated. If you don't feel like big meals, at least like snack little and often. And then you're at least giving your body a chance, because these babies, they just take from you. So they will leave you feeling rubbish if you're not replenishing that. And often as well, maybe you need like iron supplements or something, because again, that's a common thing for pregnancy, to have lower iron. Again, your baby's taking it all from you. So it's just fueling your body going forward as well is so important.
I feel like a lot of concerns that you'll mainly get is kind of fear of labour, especially for first-time mums. I mean, we had a quick discussion before the podcast, and like, what would our concerns be and what would our fear be? And a lot of it was about,
mine would be the exact, like, giving birth.
Yeah.
That would be the scariest part of me.
I think it's the pain association, right? And even like in films, TV, it looks scary.
Yeah.
And so what kind of concerns do you normally get? Is there certain questions that people are always asking? Or?
Yeah, I mean, I think it's just a generalization. Like you say, our society is not grown up around birth being a normal thing. And, you know, back in the day, you'd be in your house with the women of the family, mums, aunties, sisters, grandmas around you to support you in birth. And that's kind of where midwife actually came from, is like, you know, with woman is what midwife actually means. So it's all about being with the women and supporting them through a life-changing thing. So often I think we've lost that. You know, in the UK, I worked with a home birth team when I was a student midwife, and it was amazing because actually the first home birth I ever saw was, it was her, I think, fourth baby of all girls. She was also one of, I think, maybe 4 girls, and her daughters were around. They were, you know, they were quite little, but they were aware of what was going on. And then as soon as the baby was born, they all were crowding around her pool that she had at home. And yeah, it was such a lovely experience. And for me, that's like, that's what birth's really about. And, you know, unfortunately, through time, it's great. We have medical advances and we give birth in hospitals sometimes, but they do save lives. But also, I think we've forgotten what nature intended. And I teach a hypnobirthing, so the way I think about birth is sometimes a bit different. It's kind of going back to, okay, well, what did nature intend? What was the reason for that? And how can we make that possible in a hospital setting, for example? So especially around like pain and contractions and the actual giving birth, it's just really about reframing the way you think about it. And that's kind of what the hypnobirthing is all about, because basically, if I was to ask you guys, what's the first 3 things that pop into your head when you think about becoming a parent, labour, birth? Give me an example of what you think of.
Pain.
Yeah.
Fear.
Yeah.
Not prepared, unprepared.
Yeah.
Negatives. And I always do that actually at the start of my hypnobirthing classes, and then by the end we get the pieces of paper back out and say, have I changed your mind? Because actually, you know, it's all about just reframing your brain, because your subconscious is there to keep you alive. It's like your fight or flight. And again, hospitals also are usually a place you come if you're unwell or something's not good or a family member's not well. So they're all negative things. And you know, luckily in Dubai, a lot of the time we choose hospitals for different things. So you might only come here because you're pregnant and because you're having that nice experience, but still it's just your body knows you're in this kind of scenario. So it thinks, adrenaline, I need to save myself, like, why am I here, kind of thing. And especially in labour, that can be really kind of slow down the process and, you know, ping these thoughts of fight or flight, which is the last thing that we need when we're trying to stay calm and in control and get those good labour hormones going. So basically what you need to do is reframe what your subconscious thinks. So the way you do that is just exposing yourself to positives. So positive birth stories, positive affirmations, speaking to like-minded people, speaking to midwives, you know, all of these kind of things that tell you that it's not as bad as you think it is. And, you know, we wouldn't make good TV or films if we had these lovely normal births. They want a bit of drama. So they're never going to show you truly what birth is. And, you know, I've been with hundreds of women in labour, and actually a tiny, tiny proportion of the time is it actually an emergency where it's not so calm and in control. But the majority of people do have positive births, but they don't tell people about them because we're not programmed to tell people about the positive things. We'll always tell a negative. Actually, a doctor was telling me the other day that, you know, if someone had a negative experience, they'd tell 500 people, but if someone had a positive, they'd tell 5. So we don't hear these, you know, and especially when you're pregnant, everyone rushes to tell you their awful birth stories, and you think, why? You know,
or even to ask about the hard part. So what do I need to like watch out for and stuff, but not really ask about, okay, what was good? Yeah,
absolutely. And it's really sad because actually it's amazing. And for me, like where my background when I was a student was and why I found the hypnobirthing route kind of the way I tried to practice my midwifery is, so I was doing a nursing placement, and I was on a Alzheimer's ward, and there was a lady who was, I think she was about 90, really advanced dementia, and she couldn't even tell me what day of the week it was, but she noticed on my badge that I was a midwife, and she said, oh, what are you doing here? And then she said all 6 of her births she could tell me from start to finish. And I was like, that is amazing. So that just shows how important your birth experience is. And for a lot of people, it's just like, I'm going to go in, I'm going to get it done, and then I'll have a baby at the end. But it's not about that, because it stays with you forever. And actually, you know, being prepared will make it a positive experience, no matter what it looks like. So whether you know, plan a natural water birth with no medication, or you're having a planned elective C-section, or you want an epidural, whatever that is, as long as you're well informed and prepared and you're making decisions that are right for you, that's the most important thing. And it will be the best day ever, because you're meeting your baby after all this time, and it will, like, although yes, you might have other babies and there's other times to have different experiences, the thing I always say, and people listening that have met me will laugh because I always say it, is you only have one chance to have that baby. So the baby that's being grown right now, you have one chance of doing that birth. So don't compromise. Don't feel like, oh, I'll just see, plan for it. Educate yourself. Make sure you're happy along the way. Ask questions. Feel well supported, because that's the thing that will reduce the likelihood of birth trauma, and especially for dads as well, because actually a lot of dads are the ones that come away maybe with like birth trauma or negative experiences, because the mums obviously get so much going on and hormones and everything and baby pain relief. But for the dads, they're almost like sober in that situation. They're taking everything in, and often the mum might have gaps in the memory that then the dad will fill in. So even again, like in all of our classes, we encourage the dads to come along and educate themselves as well. One, to be a really good birth partner, but also to process it themselves, because they're also going through, they're becoming a dad, they're going to have this new baby to look after, and they're going to see their partner, the person that they love, going through something that if they don't know what's going on, it can be really scary. So it's really important, really, as a team, whether your birth partner is your husband or your mum or a friend, whoever it is, do it together, because the preparation together will then make the birth experience and life with a newborn much easier and hopefully more positive as well.
Your positivity and outlook is exactly what people are saying in the rooms. Like, you can do this, you've got this, it's a good. So the message really is to enjoy it, like where you can. Like, it doesn't have to be scary. I mean, everyone's going to be scared because it's the unknown and you don't know. But yeah, you've got to enjoy it. And I think as well, we can take comfort in the fact that like our bodies are amazing and they know what to do, right? Like your body will give you signs and tell you what to do throughout the whole process.
Yeah, and that's another thing that I always like when I say going back to nature is actually, your body, you trust it to grow the baby for 9 months, and then we suddenly lose this trust when we have to give birth. It's like, why have you lost the trust now? It's grown those eyelashes, it's grown those fingernails and every little detail. It's just that it is our kind of subconscious then that's telling us that birth is scary. Birth is this awful thing that we cannot, do, and we need help for it.
Okay, so you've just given birth to your baby. You've had a wonderful experience. It was great. The fear of then having this human to look at. So it's out of its little bubble. It's out of the controlled environment. What's the next step?
Yeah. And that often is the really scary part, because you're in the hospital, you've got, a nurse at the end of a buzzer, you've got doctors always checking, and then you're sent off home, and then it's like, okay, what now? And often, parents say they just are looking at this new baby. They're like, okay, this is mine now. I've got to keep this little thing alive and fed and watered and happy. And honestly, it is a challenging time. And this is where I think the teamwork really comes in. However you're feeding your baby, whatever choices you make is, make sure you've got that support system around you as much as you can. We're lucky at King's, actually, my colleague Nicola, she does the home care visits. So for us in the UK, community midwives is a standard. You would always have a community midwife come out to you at home, usually the day after you've gone home from the hospital, and then usually like at day 5 and maybe day 10. But here, obviously, it's a bit different because midwives are always like an added extra. But actually, a lot of insurance companies do cover it here. So it's always worth checking. And if not, then it's worth every penny, because it bridges that gap. If you don't have another appointment back in the hospital for a week or 2 weeks, then it's a long time with a new baby to know they're okay and they're gaining weight and, their jaundice levels are okay. All these kind of things that you just want to know. And again, our midwife advisory line is still open once you have the baby, so we can still help as much as possible. Always, again, I get lots of pictures of rashes and different things and cords and say, is this okay? Is this normal? And that's fine. That's why we are here. But it's great to be able to have someone to come out to your house that is a clinical professional, and we'll bring the kit that we need to do, not only for babies, but also for the mum. So we'll also do a top to toe check of mum, and if you had any stitches or you had a C-section and your wound to be checked, Nicola will do all of that as well. So it definitely is just get your village. I actually went to an event yesterday that said it takes a village, and it's very true. And think about it beforehand, because sometimes it's a bit too late when you get there and you're like, overwhelmed and overtired and it's just you and your partner maybe, then it's difficult to find it. But seek these things out beforehand and have like an action plan in place almost. So, okay, my first plan is to exclusively breastfeed. If there's any issues with that, then who am I going to go to for support? Okay, well, I've got the midwives, I've got the lactation consultant, I've got, external providers, like all of these things that you can line up. So if you need them, you've got them. Hopefully you won't, but at least then you've got a plan and it's not like 2 a.m. and Dr. Google comes in and you're frantically looking for an answer. That's really a good idea to do beforehand.
So one thing you mentioned, hypnobirthing. I don't know if we actually mentioned what it was. Can we quickly just describe? Do you know what it is?
No idea.
So I know it's about positive affirmations and reframing the way that you think about pregnancy, breathing techniques. I've been to an event with Maddy where she's done, what is the shape? So please can you explain?
Yeah, absolutely. And basically what it is just gaining knowledge. So it's like an in-depth antenatal education. So obviously we have like general antenatal classes that cover a bit of everything. But the way I teach it is over a month. So it's like we do it every Tuesday evening for 2 hours with your birth partner comes along. It's actually very birth partner focused. And I teach from a UK company, the Little Birth Company. So it's brilliant. It's just one of those things that everyone who's done it doesn't regret it. Even if they had an emergency C-section and it was, we planned for plan A and we ended up at plan Z, it still was helpful, and really it is learning the evidence behind the care that you're getting so you can advocate for yourself, know that the choices you're making are the right ones for you. It is very much geared around a positive birth experience. So no matter what that looks like, it can still be positive because you've prepared and because, you've got a good team around you, you've maybe prepared with your husband or you've got a doula or anything like that. Really it is, like you say, breathing techniques is a big one. A lot of women who do the hypnobirthing do choose to kind of avoid pain medication, but it's not a must. You can still plan to have an epidural or use an epidural and still use the techniques. Really, as well, it's about learning what your body's doing. So start to finish, what does labour look like? What is happening on the inside? So you can recognise if something's outside of that normal and then think about things you can do to help your body. So working with it and not against it is a massive one. And I think once you have that understanding, it all gets a bit less scary anyway, because you just know, okay, this is a normal thing. It might take a couple of days of stop and start contractions and a first time mum, you're not clock watching and waiting for all this to happen and think, oh, it's too slow, something must be wrong. It's normal. So already you're more calm and therefore your birth and hormones will do what they need to do. So it really is trust in the process as well, and understanding we can't always plan for birth, these babies, and your body might decide something different on the day or on the lead up and the plan might change. But knowing, we do a lot of scenarios as well. So if this was to happen, what does the evidence say, and making it individualized as well, because, a lot of the things that we do teach in the antenatal class, for example, we have to make it general because there's all sorts of women with different scenarios and backgrounds within it, that a lot of the time is just having like the one-on-one time as well. So again, drop into the clinic if you have anything along the way, because we have to look through all your pregnancy notes, if you've got any medical history. And sometimes I think it's forgotten because we do a lot of the like sideline things here. We are clinical professionals, so we can assess your pregnancy. We can recommend if a water birth, for example, would be recommended, or there's reasons that it might not be so safe. All of this kind of thing alongside your obstetrician, and we do work very closely with them to figure out, is there a way that this might be outside the guideline, but what's the way we can work that so you still can get the things that are most important to you out of it. All of this is really relevant to hypnobirthing, but also midwives in general and what our role is, which I also don't think people really know because midwives aren't a thing in every country. We're lucky in the UK, we are the lead care providers. So, we actually only refer to a doctor if something's wrong. So it's a good thing if you don't see a doctor there, whereas here it's the complete opposite. So a lot of women, especially from European countries, because midwives are often the lead care providers for normal pregnancy, are kind of shocked where it's like, well, who's my midwife? Where is my midwife? And that's kind of what we're trying to do with our new team, is be everyone's midwife as much as possible. It's a lot of work, but it's nice because we can follow people through all the way if they want to. They could come and see us after every doctor's appointment if they want to as well. So it is just knowing that we're there, and that's what we're here for.
So really, you are like a huge pillar of support for these women. Like,
Yes.
then your role in a nutshell.
Yeah, exactly. So that's all we do. Yeah, absolutely. But I think as well, it's important to know that when you are in labour, you'll have one-to-one care with a midwife. Obviously, because we're King's London, we're trying to match that British care as much as possible, and that's what you would have in the UK. And obviously, we work, again, alongside your obstetrician very closely with the plan and updating them. But often that large sense of support and clinical care for labour is from the midwives. So that's also something that people don't know until they turn up on the day. It's not necessarily that you can meet them before, because we all do shifts. But actually, even if you can't meet them before, they're all great. So you're in good hands with whoever you're with. And again, midwives are trained to be advocates. We are the experts in normal. And even if you have a very high-risk pregnancy, we can still make the things happen. So, for example, you want your music on, you want the lights low, you want to be mobile. We're there to suggest positions and monitor the baby, monitor the labour, give suggestions if things are slowed down. How can we help to speed them up? Aside from medication, positioning and breathing and all sorts of things really as a sense of support. But at the end of the day as well, we are clinically trained professionals to spot if something's outside of that normal. So if it is, that's our time to refer to a doctor, which again would be our UK practice, but even more so here, the doctor's obviously around a bit more because they're the lead care provider. But we are often the ones who are, reading the heart rate of the baby, assessing the contractions, doing like the internal examinations to see dilation, all of these kind of things. So it's a bit of both. We're a bit of everything, really.
Okay, so we're going to finish off with our final question that we ask everyone. And yours is, what is your top secret for dealing with pregnancy?
Okay, I think the biggest thing is don't forget that your body knows what it's doing. Trust your instincts, and don't be afraid to advocate for yourself, because you know your body best and you will know your baby best, whether it's in pregnancy, whether it's during labour or when the baby is born. You will be thrown loads of kind of tests and scans and vaccinations and options, and it's difficult to navigate that. So seek help, don't Dr. Google it. And honestly, trust your instincts is my biggest message, because we have lost that over time, and we need to definitely trust ourselves. Our bodies are amazing things that do incredible things as well. So trust it and don't be afraid to reach out, because we're here to help.
Thank you. Yeah. Thank you so much for coming on the podcast. We have so many questions, so we'll probably have you on again.
Anytime.
Thanks, Maddy. Thanks.